there's a motion. Is there a second to remove the item? So Councilor Stevens is second. All in favor of removing, all in favor of removing item 17A? Talk slowly while we change the battery. All in favor of removing item 17A from the table, please signify by saying aye.
Aye.
Any opposed?
No.
With that, the item is not removed from the table. It remains on the table.
Governor, do you have questions about the item? I believe that I can ask
Okay.
questions of the commissioner.
Yeah, no, I think you can as long, yeah, we just can't vote on the item. But yeah, sure.
Okay, thank you. So, Commissioner, this is a program for sex education. Can you describe the program?
Sure, it is a program that does almost sex education 101 for areas of the state that are experiencing high rates of teen pregnancy. So for this contract is for the cities of Manchester and the Claremont area. So it's for people, youth under 18, and if the youth already has a child, the age extends to 21. It's usually run in an after-school program, and it requires parental consent before the youth can participate.
And is this program in particular directed at high-risk kids?
It is directed at high-risk kids.
Can you explain what that means?
Patricia Tilley probably can give you more specifics on it, so I'm going to hand the mic over to her.
Good morning, Counselor Patricia Tilley, Director of Public Health, for the record. Thank you. So yes, this program is focused on high-risk kids. Those could be kids who have been court involved. They could be kids who have been involved in the child protection system. They could be foster children, children that are particularly high risk for both sexually transmitted infections as well as pregnancy.
And did you say that this program does require parental consent to participate in it?
Yes, it does. This program for anyone under 18 requires parent consent, and not only does it require parent consent, the curriculum that they use actively encourages parent participation. So there's work that kids do, bring back home to whoever that caring adult is within their home, and they work on projects together and do some journaling exercises. So it's really important and a prime focus of this particular curriculum to have parent engagement.
And this is an evidence-based program, it says in here. Can you describe what that means?
Sure. So we receive funding for this program from the federal government, from the Administration for Children, Youth, and Families, which is it's really actually the child protection side of HHS at the federal level. And they have, in developing this program, have said that you need to use an evidence-based curriculum. And so an evidence-based curriculum is one that's been evaluated, and in this case, to show a reduction in the number of teen births.
Teenage pregnancies.
Correct.
And is the basis of this program to educate and encourage young people to delay engaging in sexual activity? Does the program teach abstinence?
Sure. So this program is founded on being medically accurate. So it provides medically accurate information for the youth. It always leads with abstinence. The best way to prevent a pregnancy or a sexually transmitted infection is to not have sex, and that is really the primary focus. However, they do provide a comprehensive education of both about, as I refer to sometimes, the birds and the bees, what your body parts are, what they do, and also what contraception is.
So if you want to reduce sexually transmitted diseases, teenage pregnancies, and abortion, you would be in support of this program, is that right?
I would think that most people who want to reduce the number of teen pregnancies in the state of New Hampshire, especially among high-risk youth, would be in support of this program. Again, as Commissioner Chibanet noted, we've looked at the data around the state. New Hampshire is great. We have a pretty low teen birth rate. Very, usually one or two, we're usually number one or number two in the least number of teen births in the country. So, and that number has been going down, but we know that we have pockets of the state, and in particular, kids that are at higher risk. And we know with teen pregnancy, the outcomes are poor. They have poor health outcomes. Babies tend to be low birth weight. They can be more often premature. We know that there's a social, economic impact to both the mother and the child. Families are more likely to live in poverty, not have the sort of educational attainment that we'd want for all families.
How long have we had this program in the state?
This program has been in place since 2012, so just about 10 years right now, and it has been in front of the council at least 5 times.
And this council's always approved this program in the
Yes.
past? And can you just, last question, could you just describe the impact of not funding this program?
So we will have 2 programs. One, as the item is, I guess not technically in front of you, or maybe in front of you sometime, is at Amoskeag Health Center in Manchester, at the TLC Family Resource Center in Claremont. Those programs will end. This is the sole funding for them. This is a new contract for them without any additional funding. We won't be able to provide these sort of services, again, in some of the most needy parts of the state.
Thank you.
Okay, moving on, we have our items. Oh, sorry. Oh, yeah.
Thanks for speaking with me yesterday. The victims may be, the participants may be victims of human trafficking,
Correct, that is true.
and they may be victims or they may be dealing with homelessness, correct?
Correct, absolutely. Those are some of the highest risk of kids and youth that we deal with, victims of human trafficking, homelessness involved in the child protection system.
And as we discussed yesterday, because minors are not eligible to get into a harm reduction program, they may be forced to bleach their needles, correct?
Absolutely.
Yeah. And in doing so, it increases the risk of sexually transmitted diseases.
Correct.
Okay. Thank you.
Thank you.
Okay, thank you. So, moving on, we're going to move on to our items from the Department of Transportation. Could I get a motion to adopt agenda items 12 through 14A from the Department of Transportation?